Thank you.
She needs to come up with a new album.
Really?
It's been a minute.
Yes.
It's been a minute. Okay, I don't know
I'm not
music, but I had to give
right.
love and spread love to Dr. O, who's living her life. She's living her life like it's golden. I'm just saying.
Trying, girl. I'm COVID good. Like it's a different category in the pandemic universe. But yes, I'm trying to live my best life.
I have not seen you like in person. I mean, it's going on 2 years, right?
Yeah, no, definitely. Yeah.
Sure.
Yeah.
Wow. You look fabulous always. Work. Okay.
Trying, girl. A few things we can control in life, right? Yes.
I'm picking up what you're putting down. I just want to let you know. Picking up what you're putting down. That being said,
well, you look lovely. I wouldn't have known.
We are live. So, what's up, Crib community? How you doing? When you come on in the room and hit share, y'all. It's Wednesday night, and welcome to 30 at 8:30. For those of you just joining us, 30 at 8:30 is a sacred space, a beautiful space where we gather together for 30 minutes every Wednesday night just to hold the space, to have some candid conversations about structural inequities that impact some of our most vulnerable. And we've had some amazing guests. I'm super excited. I'm always excited, but I'm super excited about tonight's guest. And thank you so much for joining us. Let's see, my glasses are just keep fogging up. I mean, what's that about? Okay.
I know, girl. I'm like, mine have too much glare. I put in the contacts. I know it's like in the middle of, basically it's nighttime. I had to put in my contacts. There's too many. It's probably, I don't know, maybe my glasses are cheap, but too much glare for me.
It's just, we're just gonna work with it. Anyway, good evening, Crib Community. We're just kikiing, like we're just having coffee. We haven't seen each other in a while. I'm sorry, Crib Community. I'm sorry. Let me whoop and see. Okay. Good evening, everyone, and welcome to 30 at 8:30. I'm gonna read your bio now. I'm gonna start and get into it because we have a lot to get into tonight. So, Dr. Onye Nnorom is a family doctor and a public health and preventive medicine specialist. She is the Associate Program Director of the Public Health and Preventive Medicine Residency Program at the University of Toronto, and is the Black Health Theme Lead and Postgraduate Medical Education for the Faculty of Medicine at the University of Toronto. Come on through, sis. As the Black Health Theme Lead, she is tasked with developing educational content for teaching medical students about Black Canadian health and inequities due to systemic racism. She is the president of the Black Physicians Association of Ontario. She was also the chronic disease prevention lead at Taibu Community Health Center, where she led several successful cancer screening initiatives. Most recently, she has taken on the role of Equity, Diversity, and Inclusion Lead within the Department of Family and Community Medicine at the University of Toronto. Dr. O, as we fondly refer to her, is the host of a podcast called Race, Health, and Happiness. Check it out for more candid conversations. Race, Health, and Happiness, where she interviews successful Black, Indigenous, and other people of color to provide wisdom on how to stay well. I need more of that. How to stay well in a racialized world. Being of Nigerian and Trinidadian heritage, she is particularly interested in Black community health and wellness and how racism impacts health, in particular an anti-Black racism as a driver of inequities in Canada. Crib community, come on with it. I know you not give Dr. O a warm welcome like nobody can, Crib community. Let's do this, Crib community, yes. Yes.
Thank you.
The hearts are coming up. The hearts are coming up.
Thank you. They've been coming up, girl. Oh my goodness. I didn't know you were going to read like the full bio. But I appreciate
Yes. And yes, I am going to read the full bio because I said living your life like it's golden. You have, okay.
Thank you.
All right. So Dr. O, tell us a little bit about what drew you to this work. Like just what inspired you really?
Oh my goodness. It's a combination of influences and then I guess negative inspiration of, turning pain into purpose because it was racist experiences, right? Growing up in Montreal. I'm half Nigerian, half Trini, born and raised in Montreal, now residing in Toronto. And I need to the proper name. But going from like an urban neighborhood to a suburban, white French Canadian neighborhood and experiencing racism, not just like the kids who wouldn't want to play with me or the parents who would tell their kids not to play with me, situations like I'm 6 years old and the whole family is pretending I don't exist when I'm trying to talk to the little girl. But the classroom situation, right? So grade 1, I'm getting B's, and then grade 2, I have like all D's. And, mom had to come and, do, why is my child?
I had a visual.
My child, why is my child drawing at the bottom? Why is this? How come you didn't call me that she had D's, right? But then having to understand what that was and understand that about racism and slavery. So my parents really laid it out for me from grade 2 and using African history. So the academic became very much my coping mechanism, to understand who I am and bring that. So, academic awards, yes, I had to destroy and get all the awards. And you have to say the full Onye Chukwu when I would walk up for my award in my African attire.
Yes.
Right?
Yes.
So I think medicine, it just became full circle for me when I realized that medicine, and I'm skipping stuff like mentorship and all kinds of things that I benefited from. But when I realized in medicine that there are, social factors and the social justice work that I was interested in, the anti-racism work actually aligned with, an area of medicine called public health and preventive medicine. But I was still involved in the kind of medical violence we see in medicine that I didn't really realize. So as much as I came, I came to fix the community.
Yes.
Because that's what I was taught in medicine, that we pathologize, there's something wrong with us. And so I came with that. So that took another layer that I had to unlearn. So I learned, about social factors and justice, but it was still turned towards a negativity towards Black people that I internalized, came to work in community, and then they're like, no, girl, sit down. And so the elders taught me and the community taught me. That was my training. At Taibu Community Health Center. That was my fellowship, really, in a way, in Black health. And I saw the beauty and the resilience and Afrocentrism, and I saw people get better. My favorite part of working at Taibu Community Health Center was de-prescribing. I saw people get better through connection and through, learning different ways of bringing our foods in our ways and other ways, laughter yoga, all of that. So that largely has influenced the work that I do, the traumas I experienced, but also the beauty and innovation that I experienced in Black spaces, Black health spaces.
Transforming your pain into prolific power. I mean, prolific power. That unlearning part is deep. That, just when you really sit in it for a second, Ken Hardy's work really helped me sort of unpack some of that. I was like, what harm am I doing to myself and to others I mentor by trying to help them navigate predominantly white spaces, but giving them this messaging about we're going to talk about that later. Sorry. Just thank you for saying that. Yes. Thank you. Wow. Powerful. So I want to first start out by saying congratulations on the launch of the Black Health Education Collaborative. I mean, yet another laundry list of things on your bio, okay? But the Black Health Education Collaborative, which aims to provide Black health education for all health professionals and students with a particular focus on how anti-Black racism influences health outcomes. So congratulations, kudos, shout out. I mean, yes, you're doing your thing. You're doing your thing.
Thank you.
So, and I mean, I can't think of anyone better to lead this initiative. Okay, since it's so much, again, from both your head and your heart space, I can think of no one better. But I want to ask a question. Can you talk about some of the ways systemic racism impacts our health?
Yeah, so I'll talk about some of those ways, and then I might just share something a little bit personal. I don't usually do that, but you're my sister, so I will, and I think it might be helpful in this space, so I'll share something. But let's talk academic first. So, the ways in which we experience racism can be, as we know, it can be in our face, or it can be just in the air, like a toxin, like, just air pollution of the barriers with regards to income, job market, education, all of these things that's in our everyday lives and the indignities we face. So the way that it can often manifest, if we're looking at a population level for Black communities, is what I call the direct and the indirect. So the direct is actually when you, as a Black or racialized person, know the racism that you're experiencing, which, depending on where you're coming from, particularly if you immigrated here and you're new here, takes a little bit of time to be sensitized to and recognize it. But if you grow up like, I did here, or grow up in North America, you are sensitized from the time, as I mentioned, in the classroom from a very young age. So you recognize it. And so that is trauma, that is violence. I was speaking to Dr. Roberta Timothy, excellent, just amazing leader on anti-oppression psychotherapy. We did a panel earlier today. And it's really understanding that that is violence. And so when we take that in and we know it's happening, those microaggressions, those comments, that surprise when you're the person who, applied for the apartment or the condo or whatever, as a Black face, all of those types of indignities then end up causing a stress response. Yeah. So you're either experiencing it with regards to mental health, or it's your physical health, or you might be delaying accessing healthcare, right? We know Black and Indigenous communities tend to do this. It's a negotiation in your own mind of how much harm versus good is going to happen to you when you access healthcare. Right. So you delay, right? Which causes its own harm. You're not going to go for your mammogram. You're not going to go for,
appraising what's going to be hurtful or helpful to you.
Yes. Yeah. And then there's the indirect. I say sometimes, in speaking to some of my patients who present with a lot of stress and they can't put their finger on it, particularly I find with my newcomer Black patients, I say, whether, because systemic racism is a very academic term, but whether systemic racism or not, as a Black person in Canada, it knows you. And so it's that working, they call it twice as hard. It's 10 times as hard. A Black woman is 1.5 times more likely than a white woman to be overqualified for her job. This, North American dream of education is the great equalizer. You come into that level of education and realize it is not equalizing anything. I mean, you could marry into the royal family. It's still not going to, justice is the great equalizer, and anything less than that is not the great equalizer. You climb, education has value, but there is no, great equalizer per se, unless we have justice, unless we have our full humanity. So that takes a toll on people when you're working, you're doing 3 jobs. I mean, I'm one of those people that you saw that job description, so no shade. Those who have 3 jobs.
Like 6, just so that's 6.
Yes, yeah, okay, technically yes, 6 with the paid and the non-paid together. But it's that, so that takes its toll as well. And I think even with this pandemic, what we tried to get across is, yes, we're more likely to be the essential workers. Yes, we're more likely, despite education, to be living in lower income situations where we're in crowded situations. Yes, we're more likely to have precarious jobs where we don't have sick days. But being Black in and of itself ends up being a risk factor, not because of biology, but because of anti-Black racism.
Tell it.
So you folks know, if you had an exam or you just lost your job, all of a sudden you feel yourself get a flu. Thank you. Girl, I didn't even know you had that. I love that. But you'll feel yourself with some stress that you might be feeling. It could be an exam, it could be whatever. I mean, get cold symptoms or the flu or the stomach flu, it affects your neuroendocrine system. So it in and of itself predisposes you to, you know, chronic diseases, yes, like hypertension, diabetes, and presenting earlier, but also affects your immune system in and of itself. Because I was dealing with the province and I'm like, all this just going by neighborhood, there's Black people who live in other neighborhoods, but they're going to be at higher risk.
That's right.
And again, not because of biology, but anti-Black racism. So those are the ways. But I want to talk to you for a second about the ways in which we carry trauma. Because we don't have the resources, we don't have the culturally appropriate resources, and we lose some of our traditional ways.
Yeah.
So, girl, I have to tell you, it felt like a movie today, and you broke me today, and so you're gonna have to fix me. I was like, okay, what are we talking about today? You know, poor Janelle. I'm like, I need to know. And you know, we're gonna talk about what we're talking about now. But in the title of your work, which I have seen many times, but for some, like I said, like a movie, my eyes focused on the word friends, because it's homicide victims, their families, and friends. And for some reason, either my brain didn't process that, and it's like my eyes zoomed in on friends, and then I began to remember. And like I said, I grew up in a lower income neighborhood. We moved to the burbs, but all my friends were in those neighborhoods. So that's where I continued to hang out as a teenager. And so I started to remember like the funerals. And, when my good friend, my best friend's boyfriend, like in a shooting, gang thing, and passed away, and that funeral. And then I remembered I stopped going to funerals. I remember feeling as a teenager like whoever I was sitting next to crying could be the next person who was shot, and it was pointless going to funerals. And I began to just remember. I remembered, the shootings, and I remembered one which I would call a homicide by the state, which was, growing up in Montreal, there was one of my friends, their little sister, who was 14 at the time, was like in juvie, I guess is what they used to call it, but in jail for like young offenders. She was 14, and there was a fire in the prison. I'll just call it a prison, and they didn't let them out.
I got you.
So we never got to process these things, right? And so I reflect on, like, when we do this work, I'm always like, I'll help, but then it's not really my thing. And I realized that I was actually manifesting avoidance, because these are the ways we experience trauma. And, yes, people hug you and people might kind of talk about it, but not in the way that one would need to talk about it as young people who are seeing other people their age pass away in violent ways, and no acknowledgement by the state, no resources. So I want to thank you for the work that you are doing, but for whatever reason, I just started like remembering and crying today. So like I said, you broke me, and I have all them jobs, so you're gonna have to fix me.
Wow.
But I hope that we can use. I share that for two reasons, because as a physician, when we share trauma, it has to be for a reason, and it's not to traumatize, and it's also not to engage in the trauma voyeurism that I can't stand. So it's really to say that we can carry a lot of trauma, because in our Black lives, we often feel like we have to keep going. And at a very young age, we realize.
We're taught that.
And so, but we can still do the work. So I recognized it today. I recognized my avoidance. I recognized my defensiveness. Like, what are we talking about? And, some of those behaviors that I don't usually do. I do other Instagram lives. I don't ask what are the questions. But it was me kind of protecting, and I guess not wanting to remember, but I do remember. And so we will, I'm hoping to find ways to collaborate, and I can honor those memories, because I stopped going to the funerals.
So, sis, I see you, and I'm so honored that you trusted me with your truth. And I've got you. I've got you back, front, and everything in between. I've got you.
Thank you.
I got you. Thank you so much. I mean, wow. Do we really need to go on?
Sorry, I know that was heavy, but I thought about it. Like I said, I don't always share. I don't share, especially if something is unresolved. I tend not to share, but I think it's important to sometimes share when it's not resolved. That it's, you know, yes, I have those degrees and all the blah, 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 but there's still trauma that I carry that went unrecognized until, for whatever reason, you know.
But Dr. O, you're describing what I know to be true for so many Black survivors of homicide victims, for so many of us, is that the chronic exposure, coupled with the trauma that we experienced because of anti-Black racism, right? And then the chronic exposure to homicide after homicide after homicide, whether it's a family member and friend. And we as Black people don't distinguish between the two, right? Friends are sometimes aunties, so I got tons of aunties that aren't not necessarily related by blood. And so that sort of intersection and that confluence of those multiple traumas and the way in which we've been taught, and not judging our family, you know, not judging my mom or my grandmother for saying, you know, remember who you are, remember that you got to help your community, but also remember you have to strategically know how to navigate white spaces. And this is what this means to do that, right? Work hard, work twice as hard, right? Those messages that we've been taught have been necessary for our survival, but they also have not allowed for us to unpack all of the traumas. So, totally normal experience to that, which is not normal. So thank you for that.
Thank you.
So, wow. I want to ask another question to take a little bit of a deeper dive into sort of your work. You've spoken a lot about how systemic racism functions as a social determinant of health and have advocated for the collection of race-based data to further understand racism as a social determinant of health. I'm wondering if you could say a bit more about this effort and why it's so important as it pertains to improving Black health, Black lives.
Yeah, so I mean, the collection of race-based data is a complex topic, because we have to understand that the collection of the data is, I would say, necessary, but not sufficient for change. And so when we want to kind of prove or hold leaders accountable around racism, we collect race-based data to, you know, measure the impacts of racism, or to see what interventions are addressing them, right? It's to look at racism. But the way it's been used in medicine, because in medicine, there's been this history of saying, you know, the races, there's biological races, like we're genetically different, and upholds, you know, white supremacy. So we know that that's not the case. The human genome has been mapped. But in medicine, time and time again, we use it as a way to create more violence. So that is what has happened to our Indigenous brothers and sisters, our African-American brothers and sisters. It's the same. So data had been collected, and it was only used weaponized against those groups.
That hurt.
However, in the Canadian context, there are so many things that we as Black Canadians have experienced that go unrecognized or unnoticed, and we can't hold to accountability because the data isn't collected. So you do need that data collected, but, you know, for Indigenous communities, there's OCAP principles around ownership and how it's used. Most recently, we're part of EGAP. So EGAP framework developed during the pandemic by Black communities around, you know, engagement and governance, right? So there's the EGAP framework, and I can give you the link, but you can search EGAP and Black Health Equity group. So we're a group of scholars and did this work, but we have to be at the table. Like, it has to be done in a culturally appropriate way. Otherwise, the data is collected and reinforces the same stereotypes and continues to pathologize Black bodies and other racialized bodies.
That's right.
So you need that data, but we have to be at the table with the interpretation and the reporting and all of that. But it does help in holding government and leaders accountable. But like I said, it is not sufficient. During this pandemic, we wanted the collection of race-based data because at the beginning, leaders in public health, the people who had the same training I did and all the letters behind their name, stood up on TV and said, well, we know African Americans are disproportionately impacted, but we don't collect race-based data in Canada because it's not an issue. Excuse you?
Yeah, right? I'm sorry.
So we had to advocate for the collection, data was collected, showed that Black communities were, Black and racialized communities, 89% of the COVID-19 cases. But testing, was it mobilized in our communities? No, we kept pushing. Most of the agencies wanted to stop collecting race-based data part through. So more pushing. Vaccine comes, where does it go? To like all the rich areas, like they knew, like, so I saw it in real time that yes, you need to collect the data, but then the work continues and you have to bring the voices and you have to keep moving. And there were allies involved in all kinds of things. But my goodness, the way that has played out with the pandemic, it's so
deplorable.
We have to advocate for race-based data to be collected in an appropriate and ethical manner, but the fight doesn't stop there. That's all I gotta say.
Yes, and yes, and yes. But let me also say to my folks in the US watching that this phenomenon of collecting data by race and not using it for the greater good is not simply a phenomenon in Canada. Just recently, the FBI released 2020 homicide stats data and simply said there's been a 30% increase in homicide. And this is just a one-offmanship. This is nothing. But for Black folk, we've been at the top of that list for decades, for years after years after years. And it hasn't been an increase in 2019 to 2020, but we're not even unpacking that. There was no acknowledgement, no discussion about what that means for Black people. So we cannot just collect race-based data and just leave it alone. And it is not an issue that is just unique to Canada, 100%. Girl, I just want to jump through the live and just hug you because I'm just, okay. Yeah. Okay. All right. I'm gonna just get through. Okay. So I want to talk a little bit about, if we can circle back to Black survivors of homicide victims who are likely to face prolonged and complicated grief. They may also be at substantial risk for compromised health outcomes.
Yes.
I'll never forget time and time again when I interview Black survivors of homicide victims, there's always someone in the group who talks about, I feel pain where my son was shot, or shortly after my second son or my daughter was murdered, I had a stroke, or I was diagnosed with diabetes. And I have something in the works to kind of unpack that I'd want to talk to you about later, but can you talk about what does the experience of chronic exposure, specifically to homicide or community violence, what does it do to the body? And you touched upon that a little bit, but relevant to violence and that kind of trauma as well.
Mm-hmm. So there's so many mechanisms for it, right? I mean, medicine is limited in the way we understand the intersection between mind, body, and spirit. So I just want to say my learnings only go so far because I think there's so much wisdom in other areas. But we know, for instance, where there is a major trauma, we can carry that even as stress in our DNA. So that's the weathering, right? So that's DNA methylation, where the DNA kind of gets this wear and tear, so that you see that people who experience trauma end up, yes, having chronic diseases, but even where that's not the case, premature death and things like that, poor outcomes overall. So the mechanisms in the body change. Now we also talked, I talked about the neuroendocrine system. So that's basically your hormones and your nerves and things like that. So yes, you might manifest it as PTSD or anxiety, but you also might manifest it as, increased blood pressure and things like that. So you will see all of a sudden people needing more medications, not to mention the impact of lack of sleep, the nightmares, all of those things, right? Yes. So we're just talking about a wear and tear because you're carrying that trauma. It's in you. You know what I mean? It's in there.
Right.
And I think that's the unfortunate thing with our healthcare system, because people might access it and not receive psychologically safe care. You might end up with a provider who either doesn't understand or has the biases, and so reinforces trauma, does not validate the experience, does not understand, or makes assumptions that breach the therapeutic relationship. So medicine did come as, is still a product of the colonization, project. And so there's so much legacy in that, in the way that we practice medicine and psychiatry. But that's being undone, and the work you're doing is phenomenal. But we carry it in our physical bodies and our mental health, and it really does need to be, unpacked in a safe way. So there is hope, but it is it's a wear and tear over time.
You gave us so many gems tonight, so I'm going to make sure I cite you. But whether you know racism or not, it knows you. And you very tightly, in a nice mic drop moment way, sort of uplifted the thing that I talk about. And we're always trained to not make assumptions about who enters the space. But I'm going to go out on a limb and say that because of whether racism used particularly for Black people, that I want clinicians, I want folks to make the assumption that whether that person knows it or not, when they walk in the room, they've experienced racism, and that racism is a traumatic experience for Black people. And then we have to unpack whatever the presenting physical, mental health issue is, that is also another trauma. But I want folks to make the assumption that somebody's walking in with some stuff that you may not see. So thank you for that. Thank you so much for that. Oh my gosh, it's already 9 o'clock. I cannot believe this. Okay, wait, late. I have, So knowing this, how do we as Black people go about managing our health and wellness as we continue to disproportionately witness and experience Black death, experience anti-Black racism? How do we, by any means necessary, right?
Yes.
I mean, this is a question, but I really want to know how do we manage this? Help a sister out.
Girl, that's another episode, but no, seriously, I can give you some, because I think we have to think about the different ways that we have coped historically. I mean, that's part of why I have the podcast, Race, Health, and Happiness, is to tap into some of that historical wisdom. Because my goodness, if our ancestors didn't have ways of coping collectively, then we wouldn't be here. But we're taught in the Western context that we have to do it alone, right? But I feel like, we need to continue to resist, but it's a team sport. Resistance and resilience are best played as team sports. So we need to gather, we need to have peer support. Not everybody's going to do the peer support with you, so so we need to be intentional about who we have in those spaces and confide our issues with. But there's so many ways that we have of confiding and grieving and coming together and praying and meditating. All of these things are important, but I also have learned so much from our Indigenous colleagues, right? So the Mi'kmaq saying of two-eyed seeing. So I engage in two-eyed seeing. I try to take the best of what I know of African diasporic ways of being well, but I match that with the best of European ways. So I do have a therapist, right? As much as I said you're going to fix me, I have an appointment next month.
I got you.
Right? So it's really in finding all of these different ways to cope with time, and seek what you need, because depending on the trauma and depending on the context, you need different things in your toolbox. And I know you have provided toolbox as well, but some of it largely comes from our communities. Some of it is actually being part of system change. That can be part of it, but then we have to do that inner work as well, because sometimes we overdo the system change pushing, and I'm a bad example of like 6 jobs and whatever, but we can overdo that. I'm trying to cut back. But there's so many ways of productive coping. But when we suppress our feelings, eat our feelings, drug our feelings, sorry, I do too, right? But it's being conscious of that and realizing that we are creating our own self-harm. So we have to just treat ourselves as the queens and kings and everything in between that we are. So yeah, but it's an ongoing challenge, right? In this racialized world we live in.
It's always been a challenge, but particularly more so, I think, during COVID. You know,
Oh,
I have
yes.
felt that in my spirit and bones. But that's also another side conversation.
Girl,
But
I can't even tell you how much I think about hugs now. At least it's when I was able to hug people. I'm kind of stush. I'm not the hugging type, to be honest. But this pandemic, I've been thinking about hugs, like craving hugs, like to a next level. So
oh my
I'm
God. It's
definitely feeling it.
It's true though. And I actually warn people. So when I see you, I just need you to know that it made me a little uncomfortable. It's so bad. It's so bad. Oh my gosh. Okay. I need to ask the last.
I welcome it. Yes, more hugs. More
The
hugs.
last question I that we ask of all our guests. The title of this season is 30 at 8:30, Interdisciplinary Scholarship in Action. So how might working across disciplines help to improve health outcomes for Black people? And what could this interdisciplinary gathering of the minds, if you will, look like?
Ooh, so
Somebody
it's so
has
interesting.
said they will hug you, by the way.
Oh, thank you. More hugs.
You got a
Yes,
personal fan club up in here.
thank you. I so I think I I've been thinking about interdisciplinary work, and I don't think that there's any other way. Like, when doesn't it result in a better outcome? Because we all bring our experiences, our academic lenses, and our lived experiences. And so I think that's what it has to look like if it's going to be meaningful, powerful, and create healing. Is we need to bring those different lenses. And the silos that we have had have actually been really problematic and damaging.
That's right.
So we need it all the time. And, you know, with our work with the Black Health Education Collaborative, you know, we've got scholars and people from different perspectives. And I think in that interdisciplinary piece, I think it's so important to bring people with lived experience as well. And I know you do that work. But I was in another talk or panel that I was involved in where there was talking about just, it was equity and inclusion, but like broadly, right? So they had a patient there who had been a caregiver for a cancer survivor, but I love the way she articulated the way healthcare functions. And she was like, it's not healthcare, it's treatment. And she's like, my sister who had cancer got state-of-the-art treatment, but we didn't get care. And she's like,
wow, what an incredible distinction.
She's like, it's not care. And she's like, that's what we're missing. She's like, the only person who ever asked her how she was doing was, you know, a cleaner one day who just held her hand and you know, and helped her sister. And she said, and the health care, she's like, that's not a verb. She's like, caring is the noun. And so as much as I work in healthcare, that had to come from somebody with lived experience. So I think we need the interdisciplinary, and then we definitely need the lived experience at the table so that we can shift things in our communities. So I'm keen, I'm, you know, inspired. I am so excited about your work. And so I think I'm excited to see what it will look like and how I can contribute and honor those who have passed in my own life that I think I was avoidant about, honestly. So thank you for the work that you're doing.
No, thank you. And wow, just thank you for your incredible honesty and openness, and also just standing in your truth, but standing up for our truths when we sometimes can't even speak. You've been doing that since day one, and you're continuing to do that. And thank you so very much for that. Thank you. Thank you. Thank you. Thank you.
Thank you.
Ooh, Crib community, 30 minutes wasn't enough. I mean, 30 minutes. And you gave me life, sis. I got to tell you, you gave me the virtual hug that I needed. Oh my gosh. Crib community. Can we just give some applause, some shout out, some love to Dr. O? I mean, woo, child. Thank you so much. Thank you. Thank you.
This is great. Thanks to everybody who tuned in. Thank you for inviting me. This is wonderful. Thank you.
All right. Crib community, as always, from our crib to yours, stay safe, and keep well. Have a good night.
Blessings. Thank you. Thank you, girl.